I'm Nadia.
And I'm Morgan.
And we're going to be talking about the cardiovascular system for blood vessels. So first, the heart pumps out oxygenated blood into arteries, and arteries are highways that move blood fast away from the heart, into arterioles, which are kind of just smaller arteries. They're just a little bit with less blood flow and then less blood pressure.
Then the arterioles turn into capillaries, and capillaries are where gas exchange takes place. And then they go into venules, which are lower pressure pipes than arterioles are, and they start bringing the blood back to the heart to get more oxygen. And then the venules turn into bigger low pressure pipes that are called veins, and veins bring the blood all the way back to the heart, and then the process starts over again.
So now we're going to be talking about the differences between arteries and veins. So first, arteries have a larger lumen. They also are going to have a bigger tunica media and tunica externa. Tunica externa has collagen fibers. Tunica media has smooth elastic fibers to allow for expansion and stretch for vasoconstriction and vasodilation. And then the tunica interna is a layer of simple squamous epithelium which surrounds the lumen and smooths blood flow to reduce friction. And then the vein is going to have the exact same setup, except the tunica externa is going to be a little bit bigger. The tunica media is going to be smaller, and the lumen, which is the hole in the middle, is going to be bigger to allow for more blood pressure, because blood pressure is so low in veins already. And then this is the capillary network. Capillaries are going to be in the middle of arteries and veins to connect them, with endothelial cells in the middle and then a basement membrane around the outside.
Now we're going to talk about the anatomy of blood vessels. So there's 3 different types of arteries, and first is the elastic artery. The elastic artery carries blood away from the heart, but it's also the closest artery to the heart. And then you have the muscular artery, which has the thickest tunica media, and it has more elastic fibers when it's closer to the heart, but as it moves farther away, the fibers become more muscular. And these muscular fibers are for constriction. And then you have arterioles, which are the smallest arteries, and they have 1 layer of endothelium. And you go to two different types of veins, and we have venules, which collect blood from capillary beds, and they're composed of mostly endothelium tissue. And then veins. And veins return blood flow to the heart, and they also have thinner walls to help regulate blood pressure, since blood pressure in veins is already low. In our bodies, we find 3 different types of capillaries. There's continuous capillaries, fenestrated capillaries, and sinusoid capillaries. In continuous capillaries, there are lots of tight junctions, which are for waterproofing the capillary, and there are no intracellular clefts, which intercellular clefts are cracks that allow plasma to leak into tissues of your body. And there are also pinocytotic vessels that move fluid. And continuous capillaries are found in your skin, muscle, lungs, and your CNS. And they create your blood-brain barrier, which doesn't allow much movement of anything in or out of your brain. So then you have your fenestrated capillaries, which have extra intracellular clefts, which allow movement of fluid in and out. And also they have fenestrations, which allow leakage into your tissues, and it's found in your kidney, your small intestine, and your endocrine organs. And then you have your sinusoid capillaries, which have very few tight junctions, and these are very leaky. They allow movement of fluid and nutrients in and out. These are found in your bone marrow, your spleen, and your lymph tissue.
Talk about is blood flow, blood pressure, and resistance. This is a huge topic for arteries and veins. So blood pressure is the force of blood pushing against the vessel walls, whether it be an artery or a vein. And when the heart is pumping, your blood pressure is higher, and then when your heart is resting, your blood pressure is going to be a little lower. Peripheral resistance, this is the friction encountered by blood vessels like inside of them. Blood viscosity, the thickness equals more resistance. For blood vessel diameter, the smaller the diameter, so the smaller it is, the more resistance is going to happen. And then the total vessel length, so the longer the vessel, the more resistance. Blood flow is going to be the equal of the differences in pressure over peripheral resistance.
There are three different major things that affect your blood pressure. One is cardiac output, and the other one's peripheral resistance and blood volume. With cardiac output, it's how much blood your heart is pumping. So if you have a higher cardiac output, your blood pressure is going to be higher. And then if your heart isn't pumping effectively, you're going to have a lower blood pressure. And a clinical problem that would go with this would be CHF, which is congestive heart failure, and that is going to be one side or the other of your heart affecting how much blood is getting pumped out of it. And then you have peripheral resistance, which is a resistance from something being put on your blood vessels. So if you have a higher resistance, you're going to have a higher blood pressure, and if you have a lower resistance, your blood pressure is going to be lower. And a condition that would go with this would be atherosclerosis, which would be plaques built up in your blood vessels, which is making a resistance for your blood to flow. And then third would be blood volume. If you have a higher blood volume, your blood pressure is going to be higher, but if you have a lower blood volume, your blood pressure is going to go down. And something that can be attributed to this would be hypovolemia. There's something called hypovolemia shock, which is a low blood volume, which is going to make your blood pressure go down. And your blood pressure is equal to your cardiac output times your peripheral resistance. Okay, so these are chemical controls, and this is going to be the short-term types. So we have ANF, which is an antagonist to aldosterone, and it decreases your blood volume, which in turn is going to decrease your blood pressure. And then we have your adrenal medulla hormones, which produce norepi and epi, which enhances your sympathetic nervous system, and also increases your cardiac output, which promotes vasoconstriction, which is going to increase your blood pressure. And then we have angiotensin II, which is going to decrease your blood pressure and blood volume, which then renin is going to be released, and renin is going to generate angiotensin II, which then stimulates vasoconstriction, and it promotes a higher blood pressure. And then we have ADH, which promotes reuptake of H2O in your kidneys.
So some long-term effects are all controlled by the kidneys, so it's going to be renal regulation. Direct effects are going to be the changes with blood volume, so obviously more blood volume, the kidneys are going to react to that and do it that way. But some indirect effects are going to use other things to help the kidneys regulate the blood pressure. Kidneys secrete renin, which is going to trigger angiotensin II, which is then going to cause vasoconstriction, which is going to raise the BP. And then there's other outlets after this happens. It can stimulate adrenaline cortex to secrete aldosterone, and then the kidneys are going to reuptake more sodium, that means the water is going to follow, so then you're not going to pee as much, and then your blood volume is going to go up even more as well.
So these are different factors that are going to affect your blood pressure. You have hypotension, which is a low blood pressure, and hypertension, which is a high blood pressure. Hypertension is going to be anything over 140/90 or higher, and you have primary hypertension and secondary hypertension. Primary is going to be caused by things like age, diet, heredity, stress, smoking can even cause it. And then secondary hypertension is going to be from things like kidney disease, endocrine disorders, or like an obstruction of renal arteries. Hypotension is going to be anything 90/60 or lower, any blood pressure of that. So examples are like circulatory shock, which is when your blood vessels aren't able to fill properly. It's going to cause low blood pressure. Hypovolemic shock is when you lose blood volume and you have a low fluid volume in your body, and it's going to cause you to have a weak, thready pulse, and your blood pressure is going to go down. And that can be caused from things like trauma, if you lose a lot of blood. And then you have vascular shock, which is just poor overall circulation, which leads to extreme vasodilation, which is where you get your low blood pressure from.
So this is going to be blood flow through special areas. The skeletal muscle, when you are doing an increase of activity, you have exercise hyperemia, and this comes with a lack of oxygen because your body isn't getting enough oxygen while you're exercising because blood is pumping faster and more blood is pumping through your body. For your brain, lower pH causes vasodilation, which is caused by a lack of O2, which is oxygen. And then this is causing fainting, which is basically your body telling you that you need to like reset and calm down and kind of get your blood pressure back up and over 60 millimeters of mercury. Then your skin, this is where nutrients and waste exchange happens. Your body temp tells you like a lot about what's going on. Your capillary beds, if you're too hot, your capillary beds are going to open to the outside of your skin and it's going to cool you off more. If you're too cold, your capillary beds are going to go tighten up and go almost inside of you and kind of restrict back to keep the core of your body warm. Your blood reservoir, there's about 5% of blood in your skin at any given time. In your lungs have an auto-regulation, so they're going to vasoconstrict to allow more O2 molecules to hop onto hemoglobin to give your body more oxygen. In your heart, your blood vessels are going to shut when the heart is pumping, so then that way you can get more oxygen loaded on there as well.
Okay, so this is blood flow through capillaries. You have your hydrostatic osmotic pressure. When your net hydrostatic pressure is greater than your net osmotic pressure, fluid is going to move out of the capillaries, and when your net hydrostatic pressure is less than your net osmotic pressure, fluid is going to move into the capillaries. And then this is gases and nutrients get exchanged through capillaries through diffusion and active transport. With diffusion, diffusion is going to be passive, and it's going to move from a higher concentration to a lower concentration, and O2 is going to move out and CO2 is going to move in. And with active transport, it's going to be transport of proteins and panocytosis.